I am Karaza Nicole A. Kiskisan, a student of BS Biology AB31, and I will present to you my discussion about blood pressure. Normal blood pressure is vital to life. Without the pressure that forces our blood to flow around the circulatory system, no oxygen or nutrients would be delivered through our arteries to the tissues and organs. However, blood pressure can become dangerously high and it can get also too low. In this presentation, I will discuss what blood pressure is, how it is measured, and what are the measurements mean for our health. So, what is a blood pressure? Blood pressure is the pressure of the blood within the arteries. It is produced primarily by the contraction of the heart muscle. Its measurement is recorded by two numbers, the systolic pressure and the diastolic pressure. Normal blood pressure is below 120/80 mmHg. When your heart beats, it squeezes and pushes blood through your arteries to the rest of your body. This force creates pressure on those blood vessels, and that is your systolic blood pressure. The diastolic reading, or the bottom number, is the pressure in the arteries when the heart rests between beats. This is the time when the heart fills with blood and gets oxygen. A systolic reading of 120 to 139 or a diastolic reading of 80 to 89 indicates you have a prehypertension. Here is a quick fact about blood pressure. A female hormone may protect against high blood pressure. Yes, as this may have something to do with the decreased levels of estrogen. So estrogen increases levels of nitric oxide, which is a very powerful dilator of blood vessels, and dilated blood vessels are conducive to healthy blood pressure. Estrogen not only helps keep blood vessels dilated by increasing nitric oxide levels, but it also helps reduce the levels of endothelin, a substance that constricts blood vessels and is closely linked to heart disease and high blood pressure. Also, by increasing elastin and collagen, estrogen helps blood vessels maintain healthy, flexible walls. Estrogen's antioxidant properties also reduce the type of free radicals called reactive oxygen species. These free radicals are implicated in cell damage and inflammatory responses, including those associated with cardiovascular disease. It may also help reduce sodium sensitivity, making women less sensitive to the hypertensive effects of salt. Also, in humans, blood pressure can be measured indirectly over the brachial artery, which is found in the arm, or in the femoral artery, which is found in the leg. So, what are the components of arterial blood pressure? We have systolic and diastolic pressures, which was mentioned earlier, the pulse pressure, and the mean arterial pressure. Again, the systolic and diastolic pressures are measured and recorded as a ratio of two numbers, expressed as systolic pressure over diastolic pressure. Next, we have the pulse rate. The pulse is the difference between the systolic pressure and the diastolic pressure. And lastly, we have the mean arterial pressure, which represents the average pressure of blood in the arteries. That is, the average force driving blood into vessels that serve the tissues, and the mean is the statistical concept and is calculated by taking the sum of the values divided by the number of values. Now, let us refer to the picture given in the presentation. I bet you are all familiar with these apparatuses. Yes, that is the stethoscope and the sphygmomanometer. A stethoscope can be used to listen to the sounds made by the heart, lungs, or intestines, as well as blood flow in arteries and veins. In combination with the manual sphygmomanometer, It is commonly used when measuring blood pressure. There are also different parts of the stethoscope. We have the ear tips, the oral tube, headset, tubing, bell and chest piece, and the headset. The ear tips are parts that actually go into the ear. They are usually made of rubber or silicone and have a hole in the middle for letting out sound. Ear tips are placed on the ends of the ear tubes to provide an acoustic seal as well as to improve user safety. It should provide a snug but comfortable fit for the user. They often come in different sizes to accommodate different ears. Next, we have the oral tube. The oral tube connects to the stethoscope tubing to the ear tips. They are made of metal or steel and are designed to be at the optimal angle for the best fit into the user's ear canals. The ear tubes isolate and direct the sounds into left and right paths to provide the user a clearer and more accurate listening experience. They have ribbed ends where the ear tips are then placed. Next is the headset. The headset is that half of the stethoscope often seen hanging from the healthcare professional's neck. The headset is composed of two ear tubes, tension springs, and ear tips. The tubing is responsible for transferring and relaying the frequencies or sounds picked up by the chest piece. It directs the sounds to the ear tube so that the user can hear them. Next is the bell and the chest piece. The bell and the chest piece is another circular end of the stethoscope. On two-sided chest pieces, the bell is the smaller end. Due to the smaller diameter, it has more restricted range that focuses on lower frequency sound than the diaphragm. Lastly is the diaphragm, which is the circular end of the chest piece. It is designed to pick up sounds with higher frequencies compared to the bell. Diaphragms today are constructed to eliminate chill against the patient's skin and to have better hypoallergenic properties and cruising comfort and safety for the patients examined. A sphygmomanometer, which is also known as the blood pressure monitor or blood pressure gauge, is a device used to measure blood pressure, composed of an inflatable cuff to collapse and then release the artery under the cuff in a controlled manner, and a mercury or aneroid manometer to measure the pressure. So there are also parts of the sphygmomanometer. We have the bulb, the manometer or the gauge, the valve, and the cuff. The bulb pumps air into the cuff, and an end or check valve prevents air from escaping. Next is the manometer or the gauge. It contains a watch-like movement that measures the air pressure applied to the cuff. Within the gauge is a series of copper or beryllium diaphragms that expand when filled with air. Gears convert the linear movement of the diaphragms, turning the needle on the dial calibrated in mmHg. Next is the valve. Valve allows the controlled deflation of cuff, which is critical for accurate measurement. And last is the cuff. It is placed on the arm or leg, and the cuff bladder is inflated with air until the external pressure exceeds into the intra-arterial systolic pressure and arterial flow passed in the cuff ceases. So how do we measure our blood pressure? Well, a video presentation will be played after this slide.
Hi, my name's Simon. I'm one of the final year medical students. Can I just check your name and age, please?
Yeah, my name's Andrew and I'm 25.
Nice to meet you, Andrew. Today I'd like to take your blood pressure, so that will entail me taking this cuff, inflating it around your arm, feeling and listening to your pulse. Does that sound okay?
Yeah, that's fine.
It might be a little bit uncomfortable, but it shouldn't hurt.
That's all right.
Are you okay for me to go ahead?
Yeah.
Lovely. If you just pop your arm on the table, that's lovely. time. And I'm just going to feel your pulse now. That completes the procedure. Thank you very much, Andrew.
Thank you.
To complete the procedure, I would check the blood pressure in the patient's other arm. I would then record the results in the patient's notes.
So what are the variables affecting blood flow and blood pressure? We have the cardiac outflow, compliance, blood volume, blood viscosity, and the vessel level and diameter. First is the cardiac output, which is the measurement of blood flow from the heart through the ventricles and is usually measured in liters per minute. Any factor that causes cardiac output to increase by elevating heart rate or stroke volume or both will elevate blood pressure and promote blood flow. Second is the compliance. Compliance is the ability of any compartment to expand to accommodate increased content. The greater the compliance of an artery, the more effectively it is able to expand to accommodate surges in blood flow without increased resistance or blood pressure. Veins are more compliant than arteries and can expand to hold more blood. Third is the blood volume. The relationship between blood volume, blood pressure, and blood flow is intuitively obvious. As blood volume decreases, pressure and flow decrease. As blood volume increases, pressure and flow increase. The fourth is the blood viscosity. The viscosity of blood is directly proportional to resistance and inversely proportional to flow. Therefore, any condition that causes viscosity to increase will also increase the resistance and decrease the flow. And lastly is the vessel length and diameter. The length of a vessel is directly proportional to its resistance. The longer the vessel, the greater the resistance and the lower the flow. As with blood volume, this makes intuitive sense since the increased surface area of the vessel will impede the flow of blood. Likewise, if the vessel is shortened, the resistance will decrease and the flow will increase. There are also several mechanisms through which the body regulates arterial pressure. First, we have the baroreceptors. Baroreceptors are a form of mechanoreceptor that become activated by the stretching of the vessel. This sensory information is conveyed to the central nervous system and is used to influence peripheral vascular resistance and cardiac output. We also have the antidiuretic hormone or the ADH, also known as vasopressin. It is a hormone synthesized in the magnocellular neurosecretory cells within the paraventricular nucleus and supraoptic nucleus of the hypothalamus. Last is the renin-angiotensin-aldosterone system, which is an essential regulator of arterial blood pressure. The system relies on several hormones that act to increase blood volume and peripheral resistance. Generally, the role of arterial pressure regulation is to maintain a high enough pressure that allows for proper perfusion of body tissue and organs, but not so high as to cause bodily harm. Home monitoring is also an important way to confirm if you have a high blood pressure, to check if your blood pressure treatment is working, or to diagnose worsening high blood pressure. Home monitoring is also an important way to confirm if you have a high blood pressure, to check if your blood pressure treatment is working, or to diagnose worsening high blood pressure. Home monitoring is also an important way to confirm if you have a high blood pressure, to check if your blood pressure treatment is working, or to diagnose worsening high blood pressure. Home monitoring is also an important way to confirm if you have a high blood pressure, to check if your blood pressure treatment is working, or to diagnose worsening high blood pressure. Home monitoring is also an important way to confirm if you... So when should blood pressure medication be prescribed? Well, there are also categories of blood pressure. First is the normal blood pressure. As mentioned earlier, your blood pressure is normal if it's below 120 or over 80 mmHg. Next is the elevated blood pressure. It is a systolic pressure ranging from 120 to 129 mmHg and a diastolic pressure below or not above 80 mmHg. Elevated blood pressure tends to get worse over time unless steps are taken to control blood pressure. This may also be called as pre-hypertension. Next is the stage 1 hypertension. It is a systolic pressure ranging from 130 to 139 mmHg and a diastolic pressure ranging from 80 to 89 mmHg. Next is the stage 2 hypertension. It is the more severe hypertension. It has a systolic pressure of 140 mmHg or higher, or a diastolic pressure of 90 mmHg or higher. And last is the hypertensive crisis. A blood pressure measurement higher than 180 over 120 mmHg is an emergency situation that requires urgent medical care. If you get this result when you take your blood pressure at home, wait 5 minutes and retest. If your blood pressure is still high, contact your doctor immediately, or if you have chest pain, vision problems, numbness, or weakness, breathing difficulty, or any other signs and symptoms of a stroke or heart attack, call 911 or your local emergency medical number.